Hello and welcome once again here my channel. We are I just want to let you know how I'm doing all these days with anal fistula. An anal fistula is a small tunnel that develops between the end of the bowel and the skin near the opening of the bottom anus. So it's the colon right here, and then you get an opening, a canal right there, and then the abscess here in the middle is the abscess, and then you get another opening, the skin and the butt cheeks right there. So it's a tunnel, a little hole here goes all the way to the skin of your butt cheeks right there. So today is 8/17/2023. So that's the day today, and I want to let you know that I had an infection around these days. Here. So I started a course of antibiotics. I started that. It was because it was oozing pus. It was it was draining pus. Because I have like a siton and I have another wound. So the other wound close to the siton was giving me a lot of pain, and it was painful, and it was scaring me because it's an infection. So I had this levofloxacin. I had that, and so I had this right there, and so I had these antibiotics here, and the wound was really bad. It's a skin wound, so a lot of pus was coming out. Every day there was pus, and I still have the wound, but it's no pus. It's trying to heal itself, but every time I go to the bathroom, do number two. Right now it doesn't give me any pain or anything. Now the siton, yesterday it bled a little bit of blood, not much, but every time it bleeds, even a little bit, it gives me a little pain for the next day, and then it starts draining a little bit of liquid, but it's not pus. So as long as it's not pus, you're okay. If it's another different color, like reddish, pink, something like that, is okay. But when it's pus, it's not good. So I had it for 10 days. It was a 10 days course. It was a 10-day treatment, and it did the job, I think, because the pain that I had, it went away. The pus went away. So I had that, and this is for skin. Skin. What is it? Skin. It's for bacteria, right there. It's used to cure bacterial infection. So this really did good to my skin's wound infection. You can see more about it here. Antibiotic used to treatment of bacterial infection. It is also used to treat infection, urinary tract, nose, throat, skin, and lungs. Okay, so this one really did work really good on the skin. So I just wanted to point out that. And I had like a little bit of, sometimes I did feel dizzy, confused, and that was about it. But you gotta make sure that you eat a lot. You gotta eat a lot of food while you're doing that antibiotics. Make sure you don't drink milk 2 hours prior to the pill, 2 hours after the pill. After that, you can you can't drink milk, and no yogurt, no cheese, or any milk products. With that antibiotic pill, and make sure you eat a lot when you're drinking this pill, because this pill is really strong. And this antibiotics is going to be good for skin infections. So just read all about it, and you have to go to the doctor to get a prescription in order to do these antibiotics. Well, you have to talk to your doctor or your medical about it and see if they can help you with that. But this antibiotic that I did is good for the abscess infection. The first time I got the abscess, the doctor gave me a different antibiotics, and it didn't do nothing. It didn't do anything to my infection. He just he just uh, he just healed it for maybe 20 days, and then everything came back. So these antibiotics, I hope, doesn't come back that infection. All right, let's talk about how I'm doing right now. Right now, the pain went away because that antibiotics. If you don't get that antibiotics, the other option is an incision draining. You have to go to the surgeon and you have to get it drained by an incision, and that thing hurts a lot. Ooh, be ready. Be ready to experience some extreme pain. So I think people can try the antibiotics. If that doesn't work, you have to go to get it an incision. That thing hurts. I got it twice already, and that was painful. It was hell. It was a living hell. The pain. I don't want to do it again, but if I have to, I have to. Okay, so now I'm doing okay. I've been walking after the antibiotics. Um, Maybe a whole week already, like around here. I think the 10th I finished it, something like that. So I've been walking a lot better, a lot less pain. So I've been even working on my cars because I have to fix some stuff on my cars. They're kind of old, but they run good, but something is wrong. Two of my cars. I hired some mechanics to come to my place to fix them, but he never showed up. He didn't even call me. That's real bad. So so I'm watching YouTube videos and fixing it myself. So I've been outside under my cars, and just easy stuff. Not like doing a lot of force. I can't do that still.